22, we have already discussed histological examination of the tissue and desquamato-gingivitis which reveal loss of basement membrane, no basement membrane on histopathological features of a desquamato-gingivitis case. So now we'll learn about this reversal line. What is this reversal line? Reversal line can be seen in cementum. Reversal line can be seen in the bone also. What is this reversal line in the case of your cementum? You can see here in this diagram. Okay, you can see there is a well-defined, you can see I'm marking it, this well-defined demarcated line. This line is called as reversal line. Newly formed cementum is demarcated from the root by a deeply stained irregular line called as reversal line. Irregular called as reversal line. This line will have very few collagen fibers, very few. Make a note, very few. Very few. Very few collagen fibers. Normally, it is going to have more mucopolysaccharides and proteoglycans. So protein content and carbohydrate content will be more. Proteoglycans and mucopolysaccharide content will be more. So this line is called as reversal line. Similarly, you can see such a line in the case of your bone also. So bone also you can see reversal line, you can see resting line. What is the major difference of a reversal line and resting line on a histopathology is, you can see reversal line here is irregular. Whereas resting lines, you can see nice regular resting lines are there. So resting lines are regular. So what are the lines which are given in Orbans? Okay, so now first, most of you know, osteum is a basic metabolic unit of bone. The functional unit of bone is osteum. Okay. A cemental line of mineralization matrix delaminates the Haversian system. This line contains little or no collagen. Same, the points are same about the reversal line, this there and here also. Little, very little or no collagen. So that is the reason why whenever you have a very little or low collagen, most of the time this reversal line is strongly basophilic because it's going to contain high amount of glycoproteins and proteoglycans. Same reversal line there, here. It is strongly basophilic. No collagen fibers or little collagen fibers will be present. So this line is called as reversal line. This line is called as reversal line. So what is the difference between the reversal line and the resting line? Okay, resting line is reversal line is irregular. Reversal is irregular. Whereas resting line is regular. Regular, right? Already done. Reversal is irregular. Resting is regular. Clear? Check out your question number 23. The newly formed cementum is demarcated from the bone by deeply stained irregular line termed as reversal line. Question number 24 already done. Please do answer it. Question number 24 already done. What common risk factors may explain the relationship between the periodontitis and metabolic syndrome? Yes, it is increasing in the oxidative stress and inflammatory response. Nice, very nice. 25. What findings were reported in systemic reviews regarding the weight gain and periodontitis? What happens as weight gain, as more the weight gain, more the weight, the more the periodontal problems. That is your answer C. A positive relationship indicates that higher risk of periodontitis in those who gain weight. Next, 26. Yeah, you are very familiar, very commonly asked question. What microorganism is noted to significantly increase the root caries during the periodontal disease? Yes, it is actinomyces. Any specific peculiar things for your root caries which we have discussed? How the cross-section of root caries will be? Cross-section of root caries is, yes, root caries is going to have U-shaped cross-section. Root caries is going to have U-shaped cross-section. I'm just trying to repeat few important things. And how do you treat restorative material for root caries? Restorative material of choice for root caries? Yes, restorative material of choice for root caries is GIC. Cross-section of root caries is U-shaped. most of the root caries are associated with gingival recession or periodontal problems. Most of the root caries lesions are seen in older individuals. Which of the following type of caries basing upon its location has to be given more importance? Immediate attention has to be taken to which type of root caries basing upon its anatomical location? Yes, the answer is root caries. Root caries is very aggressive form of caries. Okay, one of the most aggressive form, rapidly progressing caries is root caries. But whenever they're asking question like which type of caries has to be given immediate attention, rampant caries. That's not talking about the anatomical areas. I'm talking about anatomical areas. Enamel caries, dentinal caries, cemental caries, also called as root caries. So which has to be given more importance among these three? The more importance has to be given, immediate attention has to be given to root caries or cementum caries, right? Clear about root caries? The organism is actinomyces. 26, the answer is C. 27 is also discussed. What serious health risks are associated with metabolic syndrome? Metabolic syndrome can lead to type 2 diabetes, can lead to cardiovascular abnormalities. Already discussed. Very good. Now 28, disease. What is the definition of metabolic syndrome? What is the definition of metabolic syndrome? Yes, abdominal obesity with at least 2 of hypertension, dyslipidemia, as well as hyperglycemia. Okay, the answer is A. So in the last session in radiology, I hope Pritisha ma'am has discussed something called as osteoradionecrosis, right? Done? Osteoradionecrosis was discussed, right? Yeah. So when I'm talking about osteoradionecrosis, okay, the most important things, few important things to be added is where it is more common. Osteoradionecrosis, whenever you're going for your radiation to the head and neck area, radiation to the head and neck area. So this osteoradionecrosis is very, very common. So what happens with this osteoradionecrosis is, what are the 3 H's related to osteoradionecrosis? 3 H's related to osteoradionecrosis is 3H. Hypoxia, hypovascular, hypocellular. So these are the 3 H's related to osteoradionecrosis. This is most commonly seen in the case of your mandible compared to maxilla, because maxilla is going to have more blood supply when compared to mandible. And this is most commonly associated with etiology of radiation to the head and neck area. So questions here are from the Karanja point of view. What is the amount of radiation doses required for head and necks? Most of the times the head and necks will have a dosage of 5,000 to 8,000 garis. Okay, right? So this is a dosage that is given for most head and neck. And I hope this is already discussed for you. Production of saliva by the salivary glands will be impaired when the dosage is around, like 6,000. Okay, 6,000. When the dosage is around 6,000, this is already discussed, related to salivary dysfunction. Salivary dysfunction. Very good. Done. This is already discussed in your radiology point of view. So what happens is, whenever you have the radiation to the salivary glands damages, and there is a decreasing in the production of saliva. So whenever there is a decrease in the production of saliva, the buffering capacity of the saliva will be lost. So whenever there is a loss of buffering capacity, what is going to happen? Your critical pH values are going to hit this 5.2 to 5.5, and slowly your teeth start dissolving. Demineralization will occur. So this caries is called as what? What is the term that is given for this sort of caries due to radiation? This sort of caries due to radiation is, yes, this sort of due to radiation is called as radiation caries. And radiation caries is how many types? Radiology, radiation caries is how many types? So radiation caries is basically type 1, type 2, type 3. And out of which type is more common? Which type of radiation caries is more common? Yes, out of these 3 types, type 1 radiation caries is more common. Okay, type 1 radiation caries is more common. Now tell me, what is the fluoride that you are going to give in radiation caries cases from radiology reference? White and ferro. Yes, right. Neutral NaF is given. Very good. Neutral NaF is regularly given to prevent the radiation caries. Now tell me, radiation caries is basically a damage of teeth, but the etiology is from salivary glands, right? You have right. Radiation caries is due to radiation of teeth or radiation of salivary glands. Radiation caries is due to radiation of teeth or radiation of salivary glands. Yes, radiation caries is because of radiation of salivary glands, which leading to loss of buffering capacity, leading to the caries in the teeth. That caries is called as radiation caries. Okay, right. Now I'm clear with all. Now, one common treatment that I know about osteoradionecrosis is hyperbaric oxygen therapy, right? Right, hyperbaric oxygen therapy. In detail, we'll try to discuss from our oral surgery. Okay. And now, before going to the lines which are given in Karanza, okay, risk of radiation caries is more in this cases. This is the lines which are given in Karanza. So I kept as a screenshot. Oral conditions that increases the risk of osteoradionecrosis for a patient who is undergoing radiotherapy for oral malignancies includes periodontal probing depths of more than 5 millimeters. Probing depth should be more than 5 millimeters. Dental plaque scores are more than 40% and bone loss are more than 60. So how you is to remember these things is 4, 5, 6. What is this for? My dental plaque score should be more than 40%. DP scores are more than 40%. Okay. What is 5? 5 is 5 millimeters. My periodontal pocket should be more than 5 millimeters. And 6 is my alveolar bone, 60%. My 60% bone loss should be there. Bone loss should be more than 60%. That is 4, 5, and 6. Clear? First, you will get plaque. Plaque is going to cause pocket. Pocket is going to cause bone loss. Clear? All are in sequence. 4, 5, 6. Pocket, sorry, plaque, pocket, bone loss. 40% is 5 millimeters, 60%. So, yeah. And then goes to very peculiar lines, which I have seen in your Karanza about this osteoradionecrosis, which I'm familiar with, but I see like, you see like 29, question number 29, which treatment combination should promote for revascularization and treatment. Okay, right? Revascularization and treatment. Here, Karanza has clearly given a beautiful drug name. Okay, so I want to make it easy. So the drug name was Penta. Second one is Oxy. The third one goes with Flulin. Okay, right. So this is a drug name given. Let's split this drug into three parts. Okay, 3 parts. This drug is basically useful for treatment of peripheral vascular diseases. So you can remember P with peripheral vascular diseases. P with peripheral vascular diseases. Okay, so then X. This is basically xanthamine derivative drug, which increases the oxygen supply or which increases the blood flow by increasing the oxygen supply, which increases the blood flow and oxygen supply. Okay, right? Okay, 29, please do mark it. The answer is B. Vitamin E is one of the drug that helps in the management of osteoradionecrosis, and it is pentoxifillin. Pentoxifillin with vitamin E is the best answer according to Karanja references. Please do mark it. New thing. Done. Question number 30, what conditions increases the risk of osteoradionecrosis before the start of radiation therapy? Yes, alveolar bone loss of more than 60 millimeters. How much should be the pocket depth? Pocket depth, option A, it was given 3 millimeters. It should be more than 5 millimeters. Option B, dental plaque should be how much? Yes, dental plaque should be more than 40%, right? So the answer is C. At what dosage is salivary gland production permanently impaired? 6,000, right? Very good. 32. What is the typical total doses of radiation that are regularly given for head and neck tumors? Is 5,000 to 8,000. C.